Hello, everyone. My name is Lisa Bayley. Welcome to this Facebook Live Ask the Expert session about COVID-19 vaccination. So my name is Lisa Bayley. I work in the PAHO Caribbean office, and we're really pleased to have you joining us on these platforms today. We are on the Twitter regional page and the PAHO Caribbean Facebook page. And I have with me today Drs. Alba Maria Ropero. She is Regional Immunization Advisor with the Comprehensive Family Immunization Unit. And I also have Dr. Margherita Ghiselli, Regional Immunization Advisor for Public Health in the Comprehensive Family Immunization Unit. And we are here today to talk to you, well, to give you an update about COVID-19 vaccines. We've been in this for a while now. I think there's still questions, and we really want to be here to answer the questions that you still have wondering about COVID-19 vaccines and vaccines. Because thanks to vaccines, millions of lives have been saved across the world since the end of the 18th century, preventing and eliminating diseases like smallpox, polio, and measles. And we know that vaccines play a major role in training and preparing the body's natural defenses. Now, COVID-19 vaccines are new, and it's normal for people to have questions. And we know that things are changing rapidly all the time. So we're here to answer your questions. We know we're also battling rumors and misinformation. So we want to give you good information straight from, they would usually say the horse's mouth, but straight from PAHO's mouth. Today, I have the two experts here, and we're going to get started. I'm going to go to Dr. Alba Maria Ropero first. Let's talk about vaccinations and what's most important for us at PAHO. Equity, making sure that it's free and fair for persons to have access to vaccines. Maybe we can start there, Dr. Ropero.
Thank you, Lisa. Good afternoon to everybody. It's a pleasure to be here with you this afternoon and with the public, sharing and exchanging experiences. The vaccination in PAHO region has been doing good progress. I would say that all countries in the region have been vaccinating. 51 countries and territories actually have started the vaccination. But talking about equity, that is a very good point that we need to highlight here. 6.5 billion doses have been administered worldwide. In the Americas, more than 1 billion doses have been administered. But you will see that there are countries with a very high coverage, but there are other countries with low coverage. And the access to vaccine has been very inequitable. And that is something that we need to change. And we are trying to do a lot of efforts in order to change that. But so far, we have 24 countries in the region which are still not reaching at least 40% of the population. And you have other countries that have already achieved 70% of the population. And that is important to have in mind, especially for those countries with low access to vaccines. They haven't been able to start the vaccination of the high-risk groups, such as the elderly or pregnant women or healthcare workers in some cases. And then we call the attention to the world, and we are doing many efforts in order to change that.
Dr. Ghiselli, would you like to comment as well on the role of vaccination as a public health measure and why equity is so important? Equity.
Of course, these vaccines are incredibly effective in preventing hospitalization, severe disease, and death. And that's why we are really pushing for the most vulnerable groups, as Dr. Alba Maria was saying, the healthcare workers, the elderly, pregnant women, people with comorbidities, to receive these vaccines first, because they are the ones most at risk for hospitalization and death. And of course, we want to protect our healthcare workers who not only are more exposed to the virus because of their work, but also provide care for all other disease and conditions. So we really need a strong healthcare force. That's why it is essential to make sure that every priority group in all the countries and territories of the Americas receive at least 2 doses of the vaccine, and they are fully protected. And that is what is not happening now in some countries.
Agreed. And I think what's happening is that we're also seeing some countries moving to boosters and additional doses. So Dr. Ropero, maybe we could talk about this issue and help people to understand what's happening. So some people have already received their 2-dose vaccine schedule. Do they need a 3rd vaccine at this point? Because, you know, everybody's watching the news and they can see what's happening in some countries. Can you help us with that?
That's a very important question, Lisa, at this moment. there is a recommendation. I need to start in a different way. For the general population, we don't have a recommendation to vaccinate with an additional dose. But WHO, the strategic advisory group from WHO, reviewed the recommendations based on new evidence in order to see what was the situation with the protection of specific groups, such as the immunocompromised people or the elderly. And then there was a recommendation that immunocompromised people, such as people with active cancer, organ transplant, immunodeficiency, people with HIV, they need an additional dose in order to boost their response, to improve their protection. That means that they will need from now on 3 doses. People with immunocompromised conditions, they need 3 doses. And the other recommendation was for the elderly, people who had been vaccinated with inactivated vaccines, such as Sinovac and Sinopharm, that the evidence shows that there is a decline in the protection in the elderly. If you compare the vaccination, the elderly versus younger adults, the protection is lower. And then with the idea to improve the response, to improve their antibodies, and then they have to receive another one. And then we are talking about the primary series of 3 doses for those 2 groups. Immunocompromised people, they need not only 2, it's 2 + 1. And people with the elderly people vaccinated with inactivated vaccines, they need 3 doses, 2 + 1. Now, there is a period also, because maybe people in the audience are going to ask, what is the period between the 2nd and the 3rd dose? For immunocompromised people, the recommendation is from 1 to 3 months to have the 3rd dose. And for those people vaccinated with Sinovac and Sinopharm, the recommendation is to receive the 3rd dose from 3 to 6 months. And then that is the new recommendation. But for the general population, we need to stay with the standard recommendation of 2 doses with the pre-qualified vaccines, or 1 dose for Johnson & Johnson. That is the schedule recommended so far.
Okay, thank you very much, Dr. Ropero. And remember, if you have any questions or anything wasn't clear to you, feel free to drop your questions in the chat on either Twitter or Facebook. They will be fed to us here, and we will try to answer your questions. Now, so we've been hearing a lot about additional doses or booster shots. And there's also discussion about using different brands of vaccines. Dr. Ghiselli, can persons receive vaccines from 2 different brands?
Thank you. Excellent question. And I know this has been at the forefront of many discussions. So WHO does not recommend mixing and matching different types of vaccines, simply because there are not enough studies to clearly specify what is the safety and also the efficacy of these vaccines. How well do they work together in combination? The only exception for which we have enough data to make a statement is receiving the 1st dose of AstraZeneca and the 2nd dose of an mRNA vaccine, so Pfizer or Moderna. And this series of studies was first started when we were having some shortages of AstraZeneca, especially in the beginning of the year. And so people were being left with only 1 dose, not knowing when the 2nd dose will arrive. That spurred scientists around the world to study this combination of AstraZeneca and an mRNA vaccine. WHO has reviewed the evidence, and this is the only combination that is now recommended. However, in situations where there are no limits in terms of vaccine availability, WHO still recommends that the same type, the same product or brand be given for both doses of the vaccine.
Okay, thank you for clearing that up. And we go by our WHO recommendations for sure. If there have not been studies to prove that it is safe, then we won't recommend it. Understood. Now let's go back to this 3rd dose, booster dose, Dr. Ropero. What really is the difference between a 3rd dose and a booster dose? Because I think, particularly here in the Caribbean, people are seeing them both as the same thing.
Yeah, it's a subtle difference, but we need to make the difference to clarify here. The difference with when we are talking about 3rd dose is for those who the immune response to the initial series is not enough. Those people who don't have enough strong health, they are weaker. They have weaker health systems, and then the response is not very strong enough. And then the idea is to help them to improve their body's protection. That is the third dose as a series. And as I just mentioned, they need 3 doses now. And this is not new. For example, in influenza, we give, for the elderly, we give them the high per dose vaccine that is 4 times more antigen than the other ones for the regular people. And then that is a practice for people with immunocompromised conditions. They need to have an extra help. And that is the idea, to have this 3rd dose. And also, and then we are talking about the series, the primary series with 3 doses with the additional dose. When we talk about booster, we are talking about giving a booster a person who over time, after they finish the primary series, they observe, or people have a decrease or decline in the protection. And then over time, over months, people can have a booster dose, but we have to differentiate these two. Booster is when you finish your schedule, the primary schedule, and months later, see if there is a decline in the effectiveness of the vaccine, they could receive a booster, maybe for healthcare workers, for example. But these others that we are talking about here is additional dose for the primary schedule. That is the difference between additional dose and booster dose.
Okay, thank you. Thank you very much. Let's move now to the effects caused by a COVID-19 vaccine. I smiled, Dr. Ghiselli, when you said serious illness, hospitalization, or death, because if you stick me in the night, I'll probably jump up and say those 3 things, because I've been saying that to people over and over again, right? Why are we taking the vaccine if you can still get COVID? And that's my mantra. But people are concerned still about if there are any long-term effects caused by COVID-19. And I prefaced it with that because there are long-term effects from COVID, but are there long-term effects from the COVID-19 vaccines?
Thank you. I will talk about long-term effects and then short-term effects. I'll sneak in some additional information here. In terms of long-term effects, no long-term effect has really been identified. And remember that to date, the world has received 6.5 billion doses of vaccine across the globe in almost all countries of the world. So if there were long-term effects from the vaccine, we probably would have heard about it up until now, since we've been vaccinating since December of last year. So we've been going for 11 months and really nothing has been identified, even though scientists in all these countries keep looking very, very carefully. So no real long-term consequences from the vaccine itself. From the disease itself, certainly that's where we talk about long COVID. And that is one of the great advantages of receiving the vaccine. You're much less likely to first become infected with COVID and then to suffer from the long-term consequences. Now, for short-term effects, there can be, like with any vaccine, some very short-term consequences from receiving the vaccine. And by short-term, I mean 2 or 3 days of situations where you might have some pain at the injection site. The shoulder is a bit sore, or you have a small fever, you have very light fever, you don't feel your best. But these symptoms all go, first of all, they're perfectly normal. It's actually a sign that your immune system is reacting to the vaccine and building immunity. So it's actually a very good sign. They disappear by themselves in a couple of days. Of course, if you still feel any kind of symptoms after, say, a week, 10 days, then it's the time to speak with your physician, with your nurse, or any other healthcare provider in your community. But a short 2-3 days, soreness, headaches, it's very normal. On the other hand, if you experience none of these symptoms, that's fantastic for you. The vaccine is still working. So just to point out that 2 or 3 days of slight fever, soreness, headaches, perfectly normal, will go away by itself.
If I may, Lisa, can I add something? It's important to say here that countries are very well prepared in order to identify and notify any vaccine adverse events. And countries are ready, the health centers are ready, the healthcare workers are prepared, they are giving the information to the person receiving the vaccine. And this is very common for all vaccines. It's not only COVID. Now it calls the attention because it's on the TV all the time, but everybody is affected in this case. But the vaccines are safe, and there are good systems in order to detect any possible signal. It would be already detected at this time, as Margherita mentioned, with all these billions of doses administered.
Right. So if you do experience symptoms for some days, or they are more severe than what you would expect, to go to your physician and to say that you have recently received the vaccine and which vaccine will immediately trigger additional information. And that, again, the monitoring system that is present in every country will provide recommendations on the kind of treatment you should receive, and also what are the next steps with regards to your second dose or additional dose, if the case may be.
Okay, thank you. We do have a question on the PAHO Caribbean page from Ali Marian. She says, well, it's no secret that people with comorbidities stand a greater chance of suffering more seriously from COVID-19. She wants to know why people who are fully vaccinated may still die as a result of COVID-19. I don't know who wants to take that one.
We can start, and Margherita can continue.
Sure.
Vaccines are not 100% effective. We are talking about here vaccines that are effective around 90% against severe morbidity and hospitalization and deaths. That is very important. But we still have a proportion of the population that is vaccinated and they are not protected. And mostly in those who have underlying conditions, because as we mentioned before, the immune system is not robust enough to respond to the vaccine, to develop antibodies. That's why it's important now to give another opportunity in that series of the schedule in order to help them to develop a better response. But still, we have some that are not, that even they are vaccinated, they will get sick, they will be hospitalized, and some of them are gonna die. But maybe we have to highlight here as well that most deaths and severe cases are in those not vaccinated. The pandemic is the pandemic of non-vaccinated people. The proportion of vaccinated people is minimal in comparison with the whole proportion of people which are not vaccinated. And then we should say here that the pandemic is a pandemic of non-vaccinated people. Margherita, you want to add?
In fact, yes, thank you. In fact, there was a recent study that showed that non-vaccinated people had a 11 times higher chance of being hospitalized and dying because of COVID compared to vaccinated persons. So again, no vaccine that exists is 100% effective, but the vaccine can greatly reduce certainly your risk of hospitalization and death, but even of experiencing severe symptoms. So many people who receive the vaccine and become infected will say that they have very mild symptoms, maybe a little bit of fever. Obviously they stay at home, but nothing more. So it definitely pays to become vaccinated.
Okay, thank you very much. We have another question. I'm happy to see the questions coming in from Adrian Lord. I think we may have touched on this before, but because you may have now joined, I've seen studies and reports of booster doses with some vaccines. Have there been or are there studies stating that boosters should be given for the AstraZeneca vaccine? He's asking specifically about booster doses. I'll go to Dr. Ropero because Dr. Ghiselli just finished.
Yeah. The idea, there are studies with booster doses, many studies actually, and the idea with AstraZeneca. And remember that as Margherita mentioned before, when we had limited vaccine availability, that developed that was the opportunity to develop many studies. And then the vaccination, the booster dose with AstraZeneca is good, and it protects. And also the vaccines, the safety profile is similar to the second dose, the schedule. But there are many studies that are ongoing in this moment for booster dose.
Yep. Okay, great. Now, if someone is listening and they have not been vaccinated as yet, where can they be vaccinated, Dr. Ropero? I mean, this varies, but in general, where can people go to get vaccinated?
That is a really good question. And I see many questions like that in our chats and these sessions, and they ask us PAHO in Washington, for example. And we would like to say that is a very good question, especially for local and national authorities. Local, because they have the information where and when and what kind of vaccines are in the health centers and the schedules, or if they need, if they have open in the vaccination sessions during the weekend or nights. All of this information is at local level. They have the media, they have radio, they have other means to inform the population. It's key that they ask, and they also call the local authorities especially. But it's important that with this information, everybody gets vaccinated as soon as possible. That is the message. And then we need to reduce barriers to the access to vaccines. And we have the vaccine available open in every day. And if possible to extend it schedules at night or the weekends, that will be very useful. And also, if countries are working a lot in order to reach the unreached, for example, the rural areas or the borders, indigenous communities, and then they are trying to bring the vaccine. They have mobile teams in order to go to the remote areas. There are many efforts, but it's key to be informed where is the closest place to get the vaccine and get vaccinated.
I did definitely see that working in the Caribbean, where there were people who were interested in being vaccinated, but they just didn't have the time, or they couldn't be bothered to stand in a long line. But once that van came to their community, they asked a couple questions and they were willing to be vaccinated. So I agree, we definitely do need to decentralize vaccination campaigns. Another question is usually about travel. I'm certainly getting the travel bug. I'm ready to go somewhere. I'm tired being in one place. So I want to travel, and I have a vaccine that may not be accepted in another country. Can I get vaccinated again with another brand, Dr. Ghiselli?
No, thank you. And this is a very frequent questions that we receive from all over the region. So WHO recommendation right now is not to receive a second series of another vaccine, simply because we don't know what the safety effects are going to be. As Dr. Alba said, there are a number of studies ongoing, but we cannot test every possible combination and have results in real time right now. Eventually we will, but just not right now. So to be on the safe side, WHO does not recommend at this time to receive a second series. And I'll just make two other points at this right now. The only vaccine that WHO recognizes for international travel at this time is yellow fever. And that's why if you have one of those yellow booklets, you will see your yellow fever vaccination status placed in a special part of your vaccination card of the yellow book. No other vaccine goes there. So maybe at a second, in the future, COVID vaccine may end up there as well, but right now, only yellow fever. So all of this to say that your national vaccination card is the only documentation that is official and that someone has in order to do anything, to travel, to visit restaurants, to go anywhere else. But it's also important very much to recommend that if you are planning on traveling to another country, you should very closely check what requirements there are for entry, because countries are implementing different strategies. Some recommend a negative test 72 hours before you enter the countries. Others are requiring vaccination and quarantine once you arrive. Others are only require vaccination, but they will not let you in under any other circumstance. So there are a number of different combinations, and each country is a sovereign nation, so they get to decide what requirements they want to impose on people entering their territory, which is why it's so important to check regularly the sanitary requirements to enter a country. And at this point, I think that every government, certainly in the region, but around the world, has the requirements listed very clearly on their website. So it's very worthwhile to go and check and be sure that you will be able to enter the country because you have respected all the requirements.
I believe right now you have to be very savvy and very knowledgeable before traveling. Yeah. There are a number of things you have to have. You have to have done certain tests. You have your scan card, and you have to have your ticket and your barcode. So before you travel, you need to make sure you have your information and you know what's happening in the country that you're going to. The other question that I think a lot of people may have is around children. I have 2 young children, under 12. Are there any approved vaccines for children at this stage, Dr. Ropero?
Oh, that is another hot topic right now, the vaccination in children. And we have to differentiate here the policies, that the recommendation that WHO and PAHO has, and also the country's implementation. They can adapt this recommendation. So far, the recommendation for children is for the vaccination of children with high risk conditions, over 12 and older, children and adolescents. And the only vaccine approved for that is Pfizer, it's the only one. Now, the equity point that we mentioned at the beginning is very important here. Countries are expanding the vaccination to adolescents with different vaccines, but they don't, at this moment, they don't, many of them haven't vaccinated the high-risk groups, the elderly and others that we already mentioned. And before expanding the vaccination to other groups, countries should reach those at higher risk of death and severe disease. But that is the main objective of the vaccination right now, to prevent infections, severe infections and mortality. Before, after that, when they advance in that process, and then they can consider adapting the vaccination to other groups. They are doing different implementation or different adaptation of the policies. But right now, just to go back to your question, the only authorized vaccine, recommended vaccine by WHO is for adolescents over 12 years of age with underlying conditions. Margherita, you want to add something else?
Just to say, to reinforce once again that the only vaccine approved for children 12 and older is Pfizer. Once again, there are a number of studies ongoing to test other vaccines in children as young as 3, but these studies are in the very early stages. So once again, we just don't know what the safety and efficacy outcomes would be if we vaccinated millions of children at once. We just don't know.
Understood. And I think when this first started, we used to hear a lot about herd immunity, this herd immunity. We've now gone to the point where we have different variants. We're almost 2 years into this now. How long does immunity from vaccines last, Dr. Ghiselli?
That's the million-dollar question. So remember that the first person to ever be vaccinated with any of these vaccines was December 2020. It feels like a long time ago, but it really wasn't. So we really only have data from the last 11 months on how these vaccines act outside of the laboratory. And so far, they have been a great success. As we said, no long-term effects, hundreds of thousands of deaths averted because of the vaccines, millions of people being kept out of the hospital so others can use other services from the same hospitals and not have to stay at home. So they've been a great success, but we really don't know. In fact, it's only now that we're seeing a large proportion of the global population entering its 6th month of vaccination. That's when we start to see that indeed immunity may wane in some groups, and that's why we're having additional doses, because only now we have accumulated enough time to see how these vaccines act in the real world outside of a laboratory. And therefore, WHO and all the national regulatory agency continuously review the data from scientific studies and make their decision accordingly. But yes, it feels forever for us, but it's really been a very short time when we think about the number of data points we've been able to accumulate. So the answer is we don't know.
I think it does feel like a long time. When you said it was only December 2020, I was like, was it? It really feels like it's been a lot longer.
Indeed. And it took a year to develop the vaccine, and now we're in month 11. Yes.
Exactly. Now, I think a lot of people too are doing what some of us have called vaccine shopping. So there seems to be some belief that there's a best vaccine. Mm-hmm. Is there a best vaccine? Dr. Ghiselli, back at you with this one.
Thank you. The short answer is no, there is not a best vaccine. The vaccination development process is incredibly rigorous. As I said before, it took 1 year to develop the first vaccines, and that was an extraordinary accomplishment. A vaccine had gone from, idea to real live use in a year. And that's because countries and governments and vaccine producers, they all decided to get together, share the data, pool the funding, and be able to work together to develop these vaccines. All of this to say that no red tape was ever cut with regard to safety or the efficacy of the vaccine. These vaccines go through 3 very rigorous steps in testing the product on larger and larger groups to make sure that first at every step, the vaccine is safe. And then in the last 2 steps, step 2 and 3, that they actually do what they're supposed to do. So protect people against COVID. And already in the clinical trials, these vaccines have been tested on people of all ages and ethnicities and health conditions, so that when they come to market, the producers can say with great certainty that these vaccines do not cause any harm. In fact, they protect. In addition to what the producers say, the national regulatory agency of each country has one, plus the WHO review all the data for that specific vaccine, clinical trials, outcomes from the patients, any kind of adverse events, and an independent group of experts decides whether these data are sufficient to say the vaccine is safe and effective. And again, national regulatory agencies do the exact same thing. So once a vaccine does come to the general population, it has been tested and validated by independent experts multiple times. And then, as Dr. Alba Maria was saying, each country has a system in place to monitor vaccine safety and efficacy, even when it's being given to the general population. Exactly, because now we have millions of people taking the same vaccine at the same time, and maybe some effects that did not appear during the clinical trial may appear now. And so the normal procedure is whenever something like this happens, the vaccination is stopped, data are reviewed more in depth, and if possible, they continue. That's what happened with AstraZeneca when we were talking about thrombosis with thrombocytopenia syndrome. The data were all reviewed. Again, independent experts from WHO, national regulatory agencies, they all said that this was an extremely rare condition, that catching COVID was going to be much worse. And so they allowed the vaccine to resume. So all of this to say that the vaccines undergo a tremendous amount of evaluation, both from the producers, from the countries, from the WHO. And it's only once everyone agrees that the vaccines are safe and effective, that's when the vaccine is being used in general population. So the best vaccine is the one that's available to you first, because all of them have undergone this very rigorous procedure. So there is really no difference in between any of them, but there is a difference in whether you receive the vaccine sooner or later, because the later you receive it, the more exposed you are to COVID-19 without any kind of protection.
Agreed, and those studies continue. We continue to study and continue as as variants come and people have different conditions. We continue to study. I'm really glad we're getting questions from you. It means that you're listening to us and you're engaging with us. We do have another question. I'll give this one to you, Alba Maria. So if we don't know how long vaccines are effective in the body, that's what the question states. How do we know when a booster is necessary? I knew we'd get lots of questions on boosters.
Yep. That is a very important question. When the vaccines are made, we have the clinical trials and we have this very well-controlled condition that we know the efficacy of the vaccine. But when you apply the vaccine in the real life, when you administer that vaccine, that changes a lot of factors. For example, the cold chain, the age of people receiving the vaccine, the intervals, many things affect the effectiveness of the vaccine. And then how we know that if the vaccine is effective or not? There are many studies now evaluating the effectiveness of the vaccine. Every day, we have actually in WHO, there is a webpage that they publish what is the effectiveness of the vaccines, and especially those, the effectiveness of the vaccine against variants as well, and see how the performance of the vaccine is going on. And then in general, we can say that the vaccines are very protective, still very protective against severe disease and death. But there is a decline in the protection for infection, for mild disease. And that with that monitor system that we have, WHO has, and many countries are doing this, different studies or different approaches in order to evaluate the effectiveness of the vaccine. And then that's why WHO reviewed the evidence. For example, I recommended the need to strengthen, to boost the vaccination, to have an additional dose in those that they are not responding well. And then we know, and there is a system, and it's a very important process that we need to do, because otherwise, if the vaccine is not working well, the scientific community has to see if they have to produce other vaccines, or what is going to happen with this vaccine, or we need a booster every year, such as influenza, for example. There are many questions that we don't have the answer yet, but there is a close monitoring system in place in many countries that we can see what vaccines are working well. In general, we can say that they are working very well for severe disease, for mortality, and for variants. That is the main conclusion.
Yep. And that includes the Delta variant.
The Delta variant, yeah.
Yep.
Yes. Now, there are lots of different vaccines out there. When will WHO approve the Abdala and the Sputnik vaccines, Dr. Ghiselli?
Yeah. No, thank you. This is, again, another question that we've been receiving quite a bit. Sputnik is already being used in 10 different countries in our region, and more than 18 million doses have been given. In each one of these 10 countries, the national regulatory agencies have reviewed the data from the manufacturer, and they have declared this vaccine to be safe and effective. The exact same thing is occurring with Abdala, which is a vaccine produced in Cuba and is now being used in Cuba, obviously, but also Nicaragua and Venezuela and Bolivia. So again, and once again, this vaccine has been approved by the national regulatory agencies. These vaccines have not been approved by WHO for a simple reason. They have not quite yet completed their entire process of collecting and handing over data to WHO that WHO would need to make a decision. So it's a procedural issue. It's taking a while, but both vaccines are under consideration. They're both being monitored. And once they hand over the complete dossier according to WHO requirements, they will be reviewed exactly like any other vaccine. And then WHO will make its pronouncement. But it's quite important to clarify here that WHO can issue recommendations as to which vaccine should countries use, but it's always the national regulatory agencies who make the final decision. That's why some vaccines that have not been approved by WHO are being used in country. It does not mean that they did not meet WHO requirements. It does not mean anything except for the fact that the full dossier has not been handed over to WHO yet.
I like that most of our answers are they're finished with yet. We don't know the answer.
Exactly. Exactly.
Now, I know I've gotten lots of questions from female friends around if they want to be pregnant, if they'll be infertile, if they can have it, if it will alter their menstrual cycle or anything related to that area. Dr. Ropero, do vaccines alter the menstrual cycle in any way or affect a pregnant mother, anything like that ladies would be concerned about?
That is very important question, because we need to debunk this myth, because it's not true. There are rumors or misinformation and circulating all over the place, and then we have to highlight here that there are not unknown effects of the COVID vaccine on menstrual periods. Actually, women can receive these vaccines at any point during their menstrual period. There are many causes, for example, that they stop the menstrual period, many reasons, and people getting the vaccine are gonna say, oh, this was because of the vaccine, but there are many stress and many other things that they need to find out what is the real reason. But it's easier to blame the vaccine at this moment that investigate the real reason, and then they need to consult. And I would like to take advantage of this question in order to say that there are many questions also, the fertility on men, and all of these kind of misinformation issues circulating all over the places. And there are many studies, as we mentioned, and no evidence of any negative effects on fertility, on menstrual cycles, or any related effect on the reproductive health. And then we need to say that it's not the real reason for this kind of situations with the vaccine.
And if I may just add, remember how we just discussed how many different entities review a vaccine independently from one another. So no vaccine would ever be approved if it had any effect on fertility, men or women. And this is not just one entity saying it, it's multiple, including the countries itself.
Exactly, exactly. We have about maybe 5 minutes or so left. So if you have any burning questions, please put it in the chat right now, because I'm probably going to let these ladies go soon. I do have a question for you, Dr. Ghiselli, on persons who may have been infected with COVID-19. Now, if I get vaccinated and I get COVID-19, does that get rid of the vaccination? Do they have to start a second dose again?
No, they do not. So first of all, let's remember, as we said before, that no vaccine is 100% effective. It's close, but not quite 100% effective. And let's also remember that we need to wait about 14 days after the second dose for our bodies to build up the immunity against COVID-19. So it is very possible that a person may become infected the day after they've received their first dose and say, well, maybe the vaccine doesn't work. It does work, it's just does not have enough time. But if you do, for example, become infected after the first dose, just wait until that period when you have any kind of symptoms, fever, headaches, difficulty breathing. Just wait for that period to end, and then you can receive the second dose. And it's not really
with all vaccines, no? I mean,
Yep,
you wouldn't
exactly.
take any vaccine if you were ill, correct?
Actually, you shouldn't leave the house, because ideally you would be quarantined, you would be self-isolating. And that's really the main point here. We would not want you to feel obligated to go get your second dose if you do have COVID, because then you are posing a risk to everyone around you, including the vaccinator, and we really need those vaccinators. So just wait until your symptoms disappear, and then you can receive the second dose. It will count as your second dose. Wait 14 days and you will be protected.
Okay, ladies, I think I've gone through most of the questions that people have asked me, and some of those that we have gotten in the chat. I'm going to give you maybe some last words. I'll go to you first, Dr. Alba Maria Ropero. You first. Any last words?
Yeah, I would like to highlight a group here to get vaccinated, which is the pregnant women, before we close. The pregnant women are a group that is demonstrated now that are at a higher risk for severe disease, the hospitalization, the use of UC. ICU, sorry.
Yeah.
And then the risk of them to die is very, very high in comparison with the non-pregnant women. And also the risk of preterm birth, that is another consequence of the COVID infection. Then it's important that pregnant women, especially those with high risk conditions or older than 35 years or have diabetes, for example, those women need to be vaccinated. And also when they go to the health center, they have to be careful in the prenatal visits, because they need to be very well protected, maintaining the social distance, maintaining the use of the mask, and also the vaccination, of course, and the family members as well. We need to protect this special group because there's really, really high the risk of mortality, and we don't need another family without the main member of the family, which is the mother. And then this is a call to get vaccination, to get the pregnant women vaccinated.
Yep.
But thank you so much. I think that this has been a very nice session, and the vaccination is a shared responsibility, that we have a responsibility with ourselves, with our family, with our community. And the only way that we can control this pandemic is through vaccination, and of course with the social public health measures. But it's important to maintain or to reach high coverage in order to protect our community, and also to avoid the appearance of new variants, because we have circulation. And if we have a high circulation, we have that risk. And then the vaccines has to be updated, or we need boosters or whatever. It's more complicated if we don't do our part right now. And then the invitation is to do our part. Vaccination is such a responsibility, and then let's be safe and then get vaccinated. Thank you so much, Lisa, for this nice session, and to your audience as well.
Yep.
Thank you, Dr. Ropero. Dr. Ghiselli?
Just to take last few words from Dr. Alba Maria, the importance of social distancing, masking, hand washing, even after vaccination. Let's remember that once again, no vaccine is 100% effective, but even if it were, now we have these variants, especially the Delta variant, which is a variant of concern because it is more easily transmissible. So even if you are vaccinated, keep wearing masks indoors, maintaining your social distance, washing your hands, that's always a good one, because as we said, the chances of people becoming infected even after vaccination is still there. And once again, the more the virus transmits, the more chances are that there will be a new variant coming up. So just a reminder to continue with those safe distancing and protection practices. They're not fun, but they are necessary. And again, thank you, Lisa, very much. Thank you for everyone who's participated. Thank you for your questions. They are great. If you have additional questions, please let us know. We answer each one.
Thank you, Dr. Ghiselli. Thank you very much. And remember, you can go back and watch this. It's on our pages, so you can go back and watch this. If you missed anything, start it over, take notes. Sometimes you have some friends with particular questions. You can take notes and share them with those persons. We've also given you the website where you can get all of the information you need. Remember, vaccines work. The 3 things that I can say as soon as you tap me in the night, COVID-19 vaccines are safe, they're effective, and getting vaccinated helps us to prevent severe illness, hospitalization, and death. And every person that gets vaccinated helps us to get one step closer to getting back to our lives again, to hanging out with our friends again, to schools being open again. So please do get vaccinated. Thank you so much for joining us, and I hope you'll join us for another Ask the Expert on another day on this platform. Have a wonderful afternoon, evening, or night. Bye-bye for now.
Thank you.